Welcome to my ward. This is another episode, another period where we shall explore knowledge. Knowledge acquisition, as far as I'm concerned, is the only surest way to improve whatever we know. It's from the experience we have gathered, that we acquire knowledge. Though some may argue that knowledge could be inborn, I don't agree, because I know most of the things I have come to know are through experiences like this that I get to know them. When you read and also when you really practicalize them, that's how I believe knowledge is acquired or nurtured. The topic for discussion today is more or less a general happening amongst all the organs of the body. All organs of the body tend to compensate when there is a problem, where the organ itself probably has been infected or where it has been damaged. It now tries to enlarge itself, and you find situation of an enlarged organ bearing names like mega. So you have hepatomegaly, splenomegaly, and all the names that has to do with megaly. But the topic, like I said, is splenomegaly, knowledge, the laboratory role. Splenomegaly has to do with the enlarged spleen. The spleen is on the left side of the body, below the 9th, 10th, and 11th, the heart, the stomach area. The liver is to the right. The liver is very big, but the spleen, most time people don't know the importance. The role the spleen plays are majorly three roles. One, it filters the blood. It filters the blood because blood passes through. It has two types of tissues, the red pulp tissue and the white. The red pulp, that's where the filtering really happens. So while the white blood and the white pulp is for the lymphocytes, production of lymphocytes, and the gobbing of bacteria, parasites, and all these other organisms that were probably entered the blood, and it helps to really purify the blood. The other major role it plays is to act as a reservoir, so that when there is a shortfall, it sends out the blood and blood components and platelets, other things like that. The experience of the spleen is very common with sickle cell disease patients. Sickle cell disease patients, you know, their red blood cells have wrong configuration. The moment there is crisis, it assumes a different shape, and so when it passes through the spleen, the spleen tends to want to remove it out of the blood system, because, like I said, it filters blood. Any damaged cell, any broken down cells, and aged red blood cells, it removes them out of circulation. So it really wants to remove the sickle cells, and that's where the problem is, because there is now occlusion of the vessels. The vessels are now occluded, and then there is atrophy. The spleen starts atrophying, and in that way, it first enlarges and probably gradually starts. When it starts atrophying, it starts reducing in size, and before you say it, they're progressing. There is no spleen anymore within 5 years of the life of a sickle cell child or patient. So you can then find a situation of autosplenectomy, which is one area of diagnosis for sickle cell disease, sicklers generally. The other thing that we must also know about the spleen is that role of removing pathogens, that is harmful bacteria and viruses, are also things that really cause the splenomegaly. It makes it enlarges it when it's really trying to combat the bacterial infection. We have malaria parasite too, causing that kind of problem. in the spleen, where the spleen would want to remove all these parasites, bacteria, and you find an acute splenomegaly, where hypersplenism happens. So what we really would experience in such a situation is that the spleen is enlarged, and when the problem is overcome, then the spleen will return back to the normal shape. But there are situations where the enlargement, the splenomegaly, is chronic, that is, it's for a longer period, and in such situation it exposes the human body to more infection. It exposes it to serious infection and anemia, packing out the blood, making the patient very anemic, because all this filtering and what have you is now happening because it is now enlarged, and a serious problem for patients like that, because they keep having a situation of being anemic, and also having the situation of recurrent infection over and over, that you want to say the best solution is to remove the spleen that is making it happen, and that's what is called splenectomy, where it is removed. And after that, the patient does not suffer from any problem of recurrent infection, and as well as anemia, because it's as if it is the main cause of that kind of problem. And like I was trying to say, you have most times this chronic infection being caused by viruses. You have infectious mononucleosis caused by EB virus, and other type of viruses really presenting with splenomegaly. But how do the lab come to help? The laboratory role in all these situations is to perform certain tests so that the splenomegaly does not become chronic, and treatments are given, and you will still have your spleen returning back to size and performing very well. So the laboratory investigation that are usually done, I shall expose it as we move on to this. Splenomegaly knowledge laboratory role. To prevent splenectomy, I have explained splenectomy to mean when you want to remove the spleen itself. Usually happens when the spleen is so enlarged that it now constitutes a problem. It is now causing more infection, causing anemia, causing depletion of platelets and other blood components. So the result is to remove the spleen. But before that happens, it is better to prevent it. That is, when you are able to test early enough, those early infections that could warrant acute splenomegaly, they are treated on time, and the spleen returns back to its normal size. But the role of the spleen is very necessary. So we do not need to lose our spleen, that is, to remove our spleen, because when you look at what the role is about, the spleen is about, then you will understand. The spleen has this area inside it, the white pulp and the red pulp. The white pulp serve a different purpose from the red pulp, and the spleen itself is a reservoir, as could be seen in the role of hemopoiesis. The white pulp tissue produces lymphocytes, which release antibodies into the bloodstream to combat infection. When you have any infection, the spleen plays that role to quickly remove, to get you well again. The more prominent is the red pulp tissue. It contains macrophages that help in filtering. It filters broken cells, parasites, bipigments, and other useless substances from the blood, so that the blood is always very perfect. But When this goes on for a very long time, it causes a serious problem and enlargement, chronic enlargement for the spleen. The other area where the role of hemopoiesis is performed is iron from broken red blood cells is stored in the spleen for later use. It performs that role of reservoir for blood platelets and other blood components, and perform auto-transfusion during hemorrhage. When there is serious hemorrhage or hemorrhage, the platelets that are stored, the blood packed cells that are stored are now poured into the bloodstream. The laboratory diagnosis is very important, that we know that you can, first of all, may not know when the spleen is enlarged, except for probably discomfort that you may feel, feeling that you are filled up, because it will be compressing on the stomach, and the stomach will now let you have that urge to eat, and the doctor can easily palpate the spleen and know that it is enlarged. There is also the X-rays that could be done, CT scan, MRI, or ultrasound investigation that we could do. Further investigation will really show us the cause of the splenomegaly, that is the probably cause of the problem. The complete blood count, we call CBC, with film reading for blood cell disorder is very helpful, in that it will help one know which of the blood cells are really affected. The film reading really tells much about what is happening. It is even findings. You could make findings like cytopenia in hypersplenism, high WC counts in leukemia, presence of blood parasite, malaria especially. You will see the trophozoites and even the gametes in the peripheral blood. Calaza are helpful in determining cause of splenomegaly. Red cell fragility, yes, where these cells usually broken are now taken away from the blood system, but they could occlude the blood vessels of the spleen, and thereby deny the spleen itself the necessary nutrients and oxygen for survival. So gradually the spleen itself atrophies and disappears. So it detects hereditary spherocytosis. There are tests that does that, and hemolytic anemia. That's the fragility test. Blood culture could also help in detecting the typhoid caused by Salmonella typhi organisms, and we may also have to do take some tissue for biopsy, do histological examination to rule out lymphoma. The treatments, like we said, antibiotics for bacteria, antiparasite for parasitic or protozoan, just like we mentioned, malaria, antiviral for those that could cause infectious mononucleosis and other viral infection, so that then the surgery, when the thing starts causing serious problem, that is, it is now the main source of infection and anemia, and it has removed almost all the platelets, very useful in blood coagulation.